Chondral refers to the cartilage in the knee, and chondral resurfacing is a specific procedure whereby a worn or a defective area of this cartilage is resurfaced, which basically means covered with a specific implant, which is essentially a metal disc with a peg. And this is specific to the implants that I use are specific to yourself based on your actual anatomy and specific to your defect itself. Chondral resurfacing can treat osteochondral defects, which involve bone and cartilage, or just chondral defects, which could be cartilaginous defects. They've got to be contained within a specific area. They can be treated on any part of the distal thigh bone, the end of the thigh bone, which is known as the femur, and also on the back of the kneecap as well. These cannot treat widespread osteoarthritis. They're not a replacement as such. But other than that, as I say, if you have contained areas of wear or defects, specific defects, which we can map using an MRI scan and 3D mapping of your actual knee, and then we can identify whether you're a suitable candidate for this procedure. A good candidate for chondral resurfacing would ideally be someone who has had an isolated defect within the knee, and someone who may have failed biological therapies of regeneration or repair, someone who's actually got normal alignment of the knee as well, and someone who's actually got significant residual soft tissue in the knee, specifically the meniscal tissue. So there are a number of criteria that we have to look at, but this is something that we could discuss with yourself. But most people of that age group and even older are suitable candidates, but we assess the candidate themselves, the patient themselves, as we go through the journey to make sure that this is a suitable implant from yourself. And I'd be very early in telling you if you're not. The biggest benefit of chondral resurfacing is that it's a joint preserving procedure, and it acts as a prequel to what would be the next natural step of a partial knee replacement. And delaying this partial knee replacement gives the patient quality of life, a pain-free life for longer before having to embark on possibly this stage of partial knee replacement should the arthritis or the osteochondral defect progress to arthritis. With regards to the risks of chondral resurfacing, apart from the standard risks of introducing any implant into the body, such as a knee or even a hip replacement, there are no additional risks associated with chondral resurfacing as such. You've got to remember it's only covering a small part of the knee. And essentially when this part of the knee or the areas surrounding this part of the knee start to develop osteoarthritis, start to wear out, then the implant needs to be removed and replaced to the next natural progressive step, which would usually be a partial knee replacement, depending on how widespread the rest of the actual osteoarthritis is. With regards to recovery for chondral resurfacing, the knee still has to be opened up, what we call an arthrotomy. However, the incision is smaller than any partial or total knee replacement, and the recovery is much quicker. The patient is essentially walking the same day with crutches, and depending on how you are following the anesthetic, could even be discharged the same day. In my practice, patients are on crutches for 4 to 6 weeks after this procedure, and then recovery and return to normality is significantly quicker than would be with a partial or a total knee replacement.